Hello everyone. For our assignment, we were given Buncombe County, which is in western North Carolina. Here is a little background information on Buncombe County. The population as of July 1st, 2018 was 259,103 people. The county seat is Asheville. The county was formed in 1791 from parts of Burke and Rutherford County. The total land area is 660 square miles. Females represent 52.1% of the population. 20% of the population is 65 years or older. 90.8% of the population are high school graduates versus the average of 87.3% in the U.S. The county also has a higher rate of people with a bachelor's degree. 38.5% of the population holds at least a bachelor's degree compared to 30.9% in the U.S. For our windshield survey, we picked Weaverville, so here we compared Weaverville to Buncombe County. Looking at statistics, Weaverville seems to be a little more well off. The median value of housing in Buncombe was $209,800 compared to $243,700 in Weaverville. The poverty rate is also significantly higher in Buncombe at 11.5% compared to 5.84% in Weaverville. You will also see that the unemployment rate is also higher, and the median household income is lower in Buncombe County. When looking at Buncombe County, the top 5 employers are the Biltmore, Van Winkle Law Firm, Mission Health, Buncombe County Schools, and Ingalls Markets. Manufacturing also provides a lot of jobs in the area. There does not appear to be a lot of diversity in Buncombe County or Weaverville. For the most part, Caucasians, African Americans, and Latinos are the only ethnicities seen. You will see that Caucasians make up 89.4% in Buncombe and 94.2% in Weaverville. African Americans make up 6.3% of the population in Buncombe, followed by Latinos at 6.7%. Next, we look at health issues, diseases, and accidents. When looking at the health department website, there was a major chickenpox outbreak in 2018. The occurrence happened at a school that has a high rate of religious exemptions to the state's vaccination requirements. Crime also decreased from 2015 to 2016. The highest crime reported was larceny at 63.8%, and the lowest crime was murder at less than 1%. Cancer was the leading cause of death from 2012 to 2016 at 21.3%, while heart disease was responsible for 19.8% of deaths. For our vulnerable population, it was evident that substance abuse and mental health were the top concerns. Prescription drug use increased by 62% since 2017. 39.9% of adults have experienced emotional childhood abuse. 23.5% of adults lived in a mental illness household. 35.2% of adults reported chronic depression. 18.9% had greater than 7 days of mental health in the past month. 16.3% have been unable to obtain mental health services in the past year. Mental health and substance abuse are issues that only are increasing in severity each year, with members of the community expressing concern. Next, we come to our windshield survey. We chose to focus on Weaverville for this part. The population is 3,857 people. Weaverville begins 9 miles north of Asheville and ends when you start coming into the town. The homes in the area are a mixture of private-owned homes, rentals, and social housing. Utilities offered include water, garbage collection, snow, and ice removal. When you enter downtown, you will see a lot of local-owned stores, boutiques, art galleries, and restaurants. Unfortunately for customers, parking is limited to street side. There is also no public transportation available, with the nearest bus line located in Asheville. As you travel around, the roads have quite a few potholes that are in need of repair. In terms of recreation, there are 3 local parks with greenways. The greenways are used for exercise and walking dogs. When visiting the parks, you see a mixture of couples, families, and individuals. Down the road, you will find a local YMCA. There are 3 denominations of churches present in the area. There is a Presbyterian, Methodist, and Baptist church. The Methodist church provides child care. The social service office is located in Asheville, while there is a local fire and police department. For schools, there is a local elementary, middle, and high school, which are public schools and serve all ages. Weaverville also experiences the same health concerns as Buncombe County. There is prominent evidence of drug abuse in the area. Mental health is also a huge concern for the community. On a side note, they do have a farmer's market where members of the community can come and buy fresh produce. Next, we reach our key informant interview. Our informant was born and raised in Weaverville. She states that you see the typical health concerns such as allergies, asthma, and cancer. One area of concern for her, however, was the growing substance abuse problem she has seen in the last several years. For health care, residents either go to local primary care physicians' offices, urgent care, or Mission Health. For the most part, everyone goes to Mission Health. She seems to think that most everyone is satisfied with their care. Since there is a large percentage of uninsured residents, she says they still receive care at Mission, where they have programs for charity care and offer discounts for cash-paying customers. When we started talking about politics, she stated that Weaverville used to stand mostly with the Democratic Party and leaned more right than left. In recent years, residents have switched their affiliation to independent as they feel the Democratic Party has changed and abandoned their beliefs. Our informant had a view for the community to build a true freestanding children's hospital separate from the main hospital. She wanted the freestanding hospital to offer 24/7 pediatric services such as a separate pediatric pharmacy, dedicated pediatric anesthesia and operating room, and a pediatric phlebotomy to complement the pediatric services that are already offered. Next, we look at census of assessment data. The status of a community is split up into 3 parts: biological, emotional, and social. The biological aspect relates to morbidity and mortality rates, life expectancy, and risk factor profiles. The emotional aspect relates to consumer satisfaction and mental health indexes. The social aspect of the community is reflected by the crime rate and functional level. The people in Buncombe County have a lower mortality rate than the Western North Carolina regional average for 12 of the 15 leading causes of death. It is important to note that the mortality rates are higher than the state for chronic liver disease and cirrhosis, chronic lower respiratory diseases, and suicide. Compared to the region, Buncombe County has a high rate of mortality of acquired immune deficiency syndrome. This is likely due to the greater concentration of AIDS and HIV clinical and social supports available in Buncombe, which is lacking elsewhere in Western North Carolina. Also of concern are the rates of chronic liver disease and suicide, both which continue to increase and are higher than the region as well as the state. Some strengths include being 14th lowest prevalence of excessive drinking, 22nd highest percentage of high school graduation, and 10th highest HPV immunization coverage among adolescent males. They are also ranked 3rd for clinical care, 23rd for length of life, 10th for quality of life, 8th for social and economic factors, and 5th for health behaviors. Some weaknesses include 5th highest incidence of chlamydia, 8th highest percentage of uninsured population, and 7th highest prevalence of low birth weight infants. In terms of social status of the community, one indicator is crime rates. Crime offenses from the 2018 Community Assessment Report revealed that total crimes decreased from 2015 to 2016, with the highest crime being larceny at 63.8% and the lowest crime being murder at less than 1% in 2016. As mentioned previously, mental health and substance abuse are big issues for the area. The rate of suicide continues to be on the upward trend, although it is still slightly less than the Western North Carolina rate, but it is higher than the North Carolina rate. VIA Health is a public managed care organization that oversees Medicaid, federal, state, and local funding for services and supports related to mental health, substance abuse, and intellectual developmental disability needs. VIA works with providers to employ safer opioid prescribing practices, advocate for medication-assisted treatment, train certified peer-to-peer specialists, and support distribution of Narcan, which in 2017 proved successful in reversing over 1,000 opioid overdoses. The structure of the community is usually determined based on its services and resources. Some areas to look at include service use patterns, treatment data from health agencies, and provider-to-client ratios. Buncombe County is well-resourced in terms of clinical providers, with 2 major hospital systems, a veterans hospital, a children's hospital, numerous federally qualified healthcare centers, as well as hospice and palliative care facilities. According to the county health rankings, Buncombe County has a higher clinical provider to resident ratio than the state and country, ranking 3rd in the state. Process refers to the effective community functioning and problem solving. You can measure this in the community by looking at the community's commitment to community health, awareness of self and others, effective communication, conflict containment, participation, and management of relationships within society. Groups participate in community health assessments. An example of effective communication, management, and participation was in 2019 when Buncombe County received an award for how they responded to the varicella outbreak in 2018, which was said to be the worst since 1995. There are also many systems throughout the community which are partnering with Buncombe County to address substance abuse, IV drug use, addiction, and overdose within the area. Next is our nursing diagnosis section. Our first nursing diagnosis was related to mental health, risk for suicide. Buncombe County had 20.3 per 100,000 suicides in 2017 compared to 14.3 and 14 suicides per 100,000 for North Carolina and the U.S. Primary interventions include providing mental health resources that are accessible for all socioeconomic levels, including medications, therapeutic opportunities, and follow-up. Secondary interventions include offering examples of mindfulness, breathing, cognitive behavioral therapy, and dialectical behavioral therapy in all patient interactions. Tertiary interventions include creating safe opportunities to mitigate social isolation, such as partnerships between those living alone and pet shelters, which can be mutually beneficial. Our second diagnosis was related to substance abuse. We chose risk for impaired judgment. There were over 13 million painkillers prescribed in Buncombe County in 2017. This equals almost 52 pills for every adult and child in Buncombe County. In 2017, there were 354 opioid overdose emergency department visits in the county. 92 Buncombe County residents died from unintentional opioid overdose deaths in 2017. 502 community naloxone reversals were reported in Buncombe during 2017. Unfortunately, today in North Carolina, you are more likely to die of an overdose than a car crash. Primary interventions include approaching substance abuse as a disease process versus a circumstance related to weakness or poor morals. Secondary interventions include providing harm reduction opportunities such as opioid take-back events, needles exchange programs, and more. Tertiary interventions include teaching patients about Narcan, how to access it, and demonstrate how to use it for overdoses. Buncombe County has formed partnerships with AB Tech focusing on stigma reduction, which is with the Closer campaign. They have also formed the SAFER campaign, which focuses on harm reduction related to the opioid crisis. Helena Burial Child Crisis Center is a 16-bed crisis stabilization and substance abuse unit for adolescents and children. It is the second of its kind in the state. Providers have implemented the STOP Act to curb opioid use and abuse. It will hopefully soon offer more options for recovery for the low-income population. One of the big points of the STOP Act is to limit the amount of pain medications that can be prescribed for acute pain. Another strength of Buncombe County is they are rated highest in low-income housing. This could lessen stressors for homeless people living in tents throughout the county. When looking at community weaknesses, 13% of Buncombe County is uninsured compared to 6% in North Carolina. Prescription drug use has increased by 62% since 2017. There's a huge gap in treatment and care options. 39.9% of adults have experienced emotional childhood abuse. 23.5% of adults lived in a mental illness household. 35.2% of adults reported chronic depression. 18.9% had greater than 7 days of mental health in the past month, while 16.3% have been unable to obtain mental health services in the past year. For the conclusion of our we found this to be a great way to engage in the community to identify areas of strengths and weaknesses of the community so that improvements can be made for the overall health of the residents. For maximum benefits to be seen, the whole community needs to come together. We as a group also learned how to conduct a community health assessment and the importance of community health nursing. This assignment has impacted our current work practice by emphasizing the power of teamwork and has greatly improved our leadership skills. And here are our references.